Hi there, this is Dr. Terry McCatton, plastic surgeon at West County Plastic Surgeons of Washington University. Today I'd like to talk to you a little bit about how patients can go about deciding what size they want to be prior to having breast augmentation or breast enlargement surgery. So there's a couple different approaches to this. I'll start by saying that very often we'll ask patients, what cup size they are, what bra size they are, and then we'll often get a response relating to their cup size, a C cup, D cup, whatever that may be. However, as it turns out, cup size is a pretty inaccurate and subjective way for us to determine how large somebody wants to be when it comes to breast augmentation. And generally speaking, it's best to communicate between plastic surgeons and patients visually, looking to see what actually size patients want to be. And I think the visual is a much more direct and clear way of communicating the desired breast size. So there's a couple different ways to do that. One thing that we often will do is we'll look at before and after photos where we know the size of the breast implant and the particular approach of a particular breast augmentation. But of course, that requires that the photos that we're looking at include preoperative photos of patients that look very, very similar to the patient who is coming in wanting to know what size they'd like to be. And that can be actually very challenging because there are so many different nuances in terms of just subtle differences between people. Things like slight asymmetries or imbalance between the two sides, the position or the shape of the chest between the two sides, the position of the nipple between the two sides, the looseness of the skin between the two sides. And as the old saying goes, no two people are exactly the same. And so there are some other approaches that can also be used. One way to check breast implant size is simply to put on a bra in the office and then use breast implant sizers of various volumes. This way, our patients are going to be able to tell what the weight of that breast implant feels like and confirm what they thought they may want size-wise. A 3D camera such as this one attached to software can be used to render a three-dimensional image, and then the software used to virtually do surgery by placing various breast implants of different sizes and shapes in manufacturers. This is a great way for our patients to get a sense of what a breast implant will look like on them in 3D. It's definitely not perfectly accurate, but it certainly does give a pretty good sense of what this may look like, and also gives, I think, some sense of what realistic expectations from breast implant surgery may look like. So in summary, when we're trying to decide what the best size and shape of breast implant is for a particular person, we'll use a variety of tools. Of course, part of that is just carefully listening to our patients to make sure that we have a clear understanding of their goals. A second option or another approach is to also use before and after photos of other patients just to get a sense of what they're looking for and to communicate visually. Using sizers in bras to get a sense of the weight and the look of that can also be valuable. And as we just showed, three-dimensional imaging is also a really valuable tool for patients to get a sense of what particular implants will look like on their bodies. If you're considering breast augmentation, we hope you'll give us a call. We're here at West County Plastic Surgeons of Washington University in St. Louis. And of course, you can find us online at www.westcountyplasticsurgeons.com or www.westcountyplasticsurgeons.wustl.edu. Thank you.